You've heard already about the power of blockchain to change so much about our consumer data, and one of the most important aspects about that is our healthcare data, our personal health. To talk to us about how blockchain technology can empower you to have more control and even ownership of your patient data are two speakers who are appearing remotely from the United States. The first is the Vice President of Integrations for EHR Data, Meghann Chilcott, and secondly is the founder of VXPASS.com, Zachary Weiner. Hello, both. Let's play the EHR Data video.
The healthcare industry is sick, complex, complicated, and impersonal. And the victim? All of us. Because while you may not be a patient today, you will be, along with everyone you know and love. Healthcare may be broken, but there is a remedy: data. And the key isn't big data or bigger data, it's better data. Right now, healthcare data is fragmented and hoarded by companies, labs, hospitals, doctors' offices. With no means to collaborate and no incentive to share, data is left split and siloed across dozens of servers. And no one, patient or provider, can see the full picture. We need a dramatic shift to put the patient back at the heart of healthcare, to build a truly patient-centric model for healthcare data. In the past, this would require scores of institutions to cooperate, potentially giving up the valuable data they control. But blockchain changes that. For 40 years, our founders at EHR Data have reinvented backwards systems in healthcare. And today, we wield a new tool that will carry us 40 years ahead. The first collaborative utility for healthcare, built on blockchain. Finally, organizations can share data without giving it away, to collaborate without sacrificing revenue, to cooperate without giving up control. And the result? Better health outcomes and lower healthcare costs. Our platform is a universal utility for healthcare. It collates data from many sources, in many formats, with custom standards, offering a full picture of patient health. It is a neural engine that brings data management and computation into one central location, creating monetization potential every time data enters, exits, or is edited. It includes both local and third-party remote compute capabilities, such as AI analysis of imaging scans. It can automate patient engagement and incentivize treatment adherence. It can create rules-based financial incentives for users, all securely stored on the world's most scalable blockchain. The first expression of these benefits is being built in-house at EHR Data, introducing our patient-first mobile data app. It puts you truly in control of your healthcare journey as a single source of truth for your data. Add healthcare data from different providers and maintain control even if you switch health insurance. Import and securely sync your personal medical data and history, and even earn money by anonymously sharing it or by consistently adhering to prescribed treatment. Your healthcare shouldn't be ones and zeros on private servers. Now it will be in your hands in service to your health. Our app is just the first example of our platform's value, and we are already in talks to integrate it and build new solutions with major healthcare players. That's thanks to seamless integration through our API. The gateway to our platform, the API can serve up requested data and write new data, all permissioned and controlled by the patient themselves. Rather than the piecemeal solutions available today, our platform is a universal utility built to grow. It's a flourishing shared ecosystem, one that doesn't just break down silos and put the patient at the core, but that also connects with existing third-party applications and algorithms to enable incredible computation capabilities, moving data between partners, triggering events, notifications, and payments, with healthcare information flowing to everyone who needs it, and no one who doesn't. It is secure, verified, immutable, and reliable, thanks to the BSV blockchain, helping patients control and benefit from their data, creating better health outcomes, and lowering healthcare costs. This is a truly patient-centric model for healthcare, balancing privacy with efficacy, actions with incentives. Our platform is a new beginning for healthcare, and our platform starts with you. EHR Data. Own your health.
All right, Meghann. So a lot of people who've been following the BSV ecosystem have wanted to know what's been going on with EHR data, including the anticipated proof of concept that you were going to run with the state of Missouri related to opioid addiction. Can you give us an update about what happened with that and what you're focused on next?
Well, the Missouri proof of concept, we've moved on from because of obstacles associated with the healthcare system right now. We had COVID testing, we have COVID vaccines, so we're allowing the healthcare system to really recover from that before we move forward with other proof of concepts.
Got it. And I understand that one of your key partners that was necessary for the project just got diverted to COVID-related priorities.
Yes.
Well, let's follow up more on what's going on with EHR data in a moment. Zach, tell us about VXPASS, what it is, and then I know we made a big announcement with you today for your company. So tell us about that too.
Absolutely. So VXPASS at its core is a digital replacement for your paper vaccination card. It is secure, it is patient-owned, and it is signed by the medical professional in a way that cannot be faked. So we've created a mechanism to authenticate both the signature from the doctor and using the core BSV tenants to authenticate the origin of the record itself.
Got it. And tell us about your project with the country Lesotho.
So the country of Lesotho, they face an interesting sort of dilemma. There's now, with COVID, a ton of information that should and probably needs to be stored. But the country itself doesn't have the technological infrastructure to stand up EHR records and cloud services, nor do they have the funds to pay the license fees for something like Microsoft or an Amazon. So a pay-per-record model where the data exists forever was perfect for the type of operation they wanted to run in tracking and tracing the distribution of their vaccine. Additionally, giving their citizens the ability to take with them a credential that says they've been vaccinated allows the mass population that travels across the South African border to work to actually go and continue to work and participate in the economy.
And then finally, summarize the announcement for today.
So previously, we had focused on point of care. Valid records need to be validated by a professional. It seemed to be the easiest case that when you are getting injected, that was the most valid point to capture that data record. But a lot of governments have actually captured that data record on their own and kept them in some sort of a database. Now, I got into this because I want to remove the personally identifiable information from those records, but they do exist and they are there for us to use. So today we are announcing that any previously vaccinated patient can get a digital record using VXPASS. In the United States, it'll be as simple as potentially visiting your doctor, or globally, you may be able to visit our online platform. We have pre-sale for your VXPASS available today on our website, and later today on RelayX. RelayX will have bundles that you can buy, family packages, office packages, but they are available for pre-purchase today on VXPASS.com and later today on RelayX.com.
So Meghann, let's go back to you. What is EHR Data's ultimate mission, and how does that relate to the importance you see of empowering patients to own their data?
Well, what's most important about EHR Data is that we're trying to put control into the patient's hand, create a global patient record where the patient can use BSV blockchain to get rewards, have their data all in one place.
And what are some of the obstacles, practically speaking, with today's healthcare system that have prevented that from happening before?
Well, historically, the healthcare system has been siloed. I mean, well, it still is today. So when a patient shows up in one place and they have some health condition, they then go to another doctor's office and that doctor's not aware of what happened before. So it's really important for that patient to get the ultimate care by knowing what the history is for that patient.
And Zachary, I know you too are a big, passionate believer in the need for patients to have ownership of data. Why is that not happening today from your review, and what are you going to be doing to help?
Sure. So I think historically it's been very expensive to stand up the type of technology that would allow patients to own their data. And traditionally, consumers generally aren't conditioned to own the data that is created when they go to either enterprise or government or big institutions. And so we've spent a lot of money as Western societies creating regulations that force these medical practitioners to save our data in a way that's secure. It's my belief that it's probably much more secure just to remove the patient data, right? Leave only the medical data and remove the patient identifying data. And now that the blockchain exists, individuals can prove that they own that data, that the data was authored for them as an individual, without the healthcare system needing to be responsible for retaining or holding those records forever. And because of that, the cost comes down, the ease of access increases, the ability to get immediate care, I don't want to say increases, but becomes actually possible. So while the old set of technologies were perfect for the emerging markets and what had become, or what has become of the Western world, in today's economy and today's technological outlook, we actually have the capability to not put that personally identifiable information at risk at all by not storing it in the same record or in the same type of record. And one thing that I would like to comment on is there is, I think EHR Data and VXPASS have taken fundamentally different approaches. EHR Data puts all of the patient data in the patient's hands and stores it in a way that the patient has access to, but the records themselves or the patient information itself doesn't necessarily stay on chain. And that's in order to fit within this system of regulation. And we went the totally opposite direction. I don't actually store, or VXPASS doesn't actually store any of that patient identifiable information. And the reason for that is the regulation. So there is this opportunity in the middle of those two right now to fill the gap, to allow for more companies like EHR Data and VXPASS to come in and provide modern solutions given the current technological outlook without being constrained by the rules prior to what blockchain has afforded us.
And you're probably referring to requirements, for example, of HIPAA in the United States, the Healthcare Information Privacy Protection Act, and in Europe, things like GDPR compliance. I want to really hone in on that. So, Meghann, patient data privacy. People are nervous about the idea of their medical information being somehow either stored on a public blockchain or managed from the chain. How do you deal with the privacy of patient data to assure people that this is safe?
Well, in short, a person's private health data isn't actually on the blockchain. We write a hash of the data to the blockchain, so it isn't human readable. The data we write is the metadata of the user's private data, so the private stuff isn't actually on the blockchain. In addition, we don't make available the linking records. So if somebody were to discern some private data, they wouldn't be able to tell who it belonged to. And our secure utility ensures strict compliance with government regulations. As you mentioned, you've got HIPAA and high-tech, and we use all protections provided to us by our platform provider and only store the hash data in the blockchain.
Okay. And Zachary, how do you approach privacy protection for patient data with VXPASS?
So we are in sort of a different health market in that the personally identifiable information is less valuable related to a vaccination record for data purposes. It's incredibly important for medical purposes, but for the data purposes, we don't actually need the name, date of birth, phone number, email, all that. So we've leveraged the blockchain services, actually specifically BSV, to create a signing schema where that data doesn't need to be stored. We only store the relevant information about the vaccine, the manufacturer, NDC, expiration, all that, and created a formulaic schema to verify the authenticity of a person's name without storing that name on the data. It's not a direct hash of their name, but it is a mechanism using the underlying technology built into BSV to validate that the name matches the name given to a doctor at the time of service without actually storing that name on chain.
For those of you on our virtual conference platform, we're encouraging people to ask questions, by the way, and you might get some of your questions asked on stage. For example, some anonymous user has submitted a question, speaking of health. How old is Mr. Nguyen for reals? I won't answer that question now, but there will be some more legitimate questions.
23.
And 23, good age. Good Asian discount. I will say, here is a more serious question, which is, how can we normalize this type of data systems you're talking about with patient data? What steps are necessary industry-wide as well as technology-wise to make this a normal part of the ecosystem? Let's go to Meghann.
Well, the most important thing about this is that we have to actually get these integrations in place with the organizations that actually have the data. So we've actually started a movement called EHR Data Wave Makers so that the patients can now start asking for this information and educate their providers, their doctors, their pharmacies that this information needs to be shared.
Zach, what do you think?
From the consumer level, I think that we also are taking a very similar approach, a ground level approach, but it's up to us to prove it. So one of the approaches that VXPASS takes is I like to show the data that we store on chain. I like to take the time to talk to people who have a different point of view, generally who might be very passionate about that different point of view, and start to explain how cryptography can protect us. If you are not a developer or don't understand quite how these cryptographic proofs work, it's hard to understand how we can get away without storing your actual information on chain and prove that it's valid. So I think that sort of education is very meaningful in getting the decision makers who can help to promote our principles and truly come to understand how that information is protected both through hashes or other forms of encryption, or even just through ownership. But the one thing that I'll say that is a real opportunity now is as we see these bigger blocks hit the BSV blockchain, it's going to become more and more important for individuals to store the transaction information from the transactions that are meaningful to their account.
Right.
And so there is one place where I think we can start to work, which is an application for patients to store their transaction records, not necessarily the information in those transactions, but just the transaction IDs themselves, so that they can be referenced later, so that the patient starts to really physically or emotionally become attached to those records in a way that isn't necessarily possible if those records only stay in a cloud or on chain and aren't in this sort of secondary individualized wallet that's got their record set, not necessarily the data or the history, but the record set that they can confidently feel that they can go back to.
All right, Zachary, you're probably the only person I know who would talk about getting an emotional attachment to your transaction IDs, but more power to you. Let's talk about the choice of BSV. Both of your companies decided to build on the Bitcoin SV blockchain and unleash capabilities we have not seen yet before throughout the history of blockchain. Why did you choose BSV, and what are some of the capabilities you've been able to ignite from the data? Meghann?
So we chose it because it's public, secure, and the ability to scale. All the data is encrypted, immutable. Once the data has entered the blockchain, it can be deleted or altered. It's public, so no single company or government has the authority over the public blockchain. And it runs and operates without relying on one organization. It removes potential political and organizational risks. We were also concerned about the ability to scale. So you can scale knowing the system can handle vast amount of data generated in the healthcare industry. In the US alone, there are over 4 billion prescription transactions that have to be sent through this blockchain and across the network. So when we needed to choose a blockchain, we knew that the healthcare industry runs at an extremely high transaction rate. And BSV was the only solution with a complementary transaction volume, with a roadmap to increase the throughput. And we wanted to be able to offer incentives and rewards to our patients. The fact is that Patients need to be incentivized, and this is what Zachary was just saying. Why do we have an emotional response to our own data? Well, because the patient owns it. They should make the money off of their own data, and we're looking at giving the BSV money to the actual patient for having access to their data. And the organizations that are going to be accessing that data as well. So it's a really great opportunity for us and the patient and businesses to be part of this.
Yeah, and the micropayments is critical to be able to distribute small amounts of payments to all of those participants, including the patient. Zach, I know you went through a process to get to BSV. Tell us about it and what it's done for you.
I did. So I used to be an Ethereum developer, and that was where I started my blockchain experience about 3.5, 4 years ago. In 2020, I started looking at new tools, and I actually landed first on Bitcoin Cash, which led me to the promise of transaction speed and the ability to pump a lot of data on chain. And as I started to play around with the tool sets and started to test the claims, I saw that BSV was saying very similar things, and it actually was easier, demonstrably, from a human perspective, about the same in speed at the time. When I started to do the testing, I found out that it was a little bit faster, and over time it became cheaper. I think what really was the kicker for me, though, was the community of what's being built on BSV. So when I started to pose questions, I got answers nearly immediately. I found libraries that could help support the decisions that I was making in business. And then most importantly, as we started to see what happened at the end of the year last year, as the prices in other cryptos ran, it really solidified the choice that we had made to run on BSV. Although the price of BSV was moving, you could actually see in the chart that there was a decoupling between the price of the asset and the price of putting data on chain. And so for us, where we work in countries that don't have the same type of income that the Western world may be used to seeing, we can't have 50-cent dollar records for to put the record on chain. Our pricing model would be broken. So for us, BSV really was the only solution that had the speed, the reliability, the price, and the community to allow us to build this in a timely enough fashion that we could launch while this was still relevant. And I'd like to just extend that one step further, that the community has been so strong that it helped me basically build this version 0.3 with new updates and the ability to backfill in a fraction of the time that I had expected, just because there was such intelligence and investment in our success. It's just one of the things that I think is amazing about open source, but really shines in BSV.
Great. So Meghann, what's next for EHR Data? What can we expect?
So there's so much happening at EHR Data. It's a really exciting time. We are advancing our vision to develop the first ever blockchain healthcare record that the patient owns, controls, and permissions. So as we seek to advance our mission, we're also working closely with companies who are looking to lower healthcare costs and get better outcomes through one view of the patient's total health picture. So our team is also exploring opportunities to leverage our utility as a foundation for other solutions that require capabilities, whether that be loyalty rewards programs, track and trace, or value-based models for specialty drugs. Whatever the vision, whatever the challenge, we're wanting to design and implement customized solutions to make a difference. And soon we're going to have a developer portal on our website, and we've got our mobile app that the patient can now access their data that we're aggregating for them.
Great. And Zachary, what about you? What's next from VXPASS?
So ideally, we will see COVID sort of start to wane and slowly decline over the next 18, 24, 36 months. And in that ideal scenario, VXPASS will be moving towards documenting childhood vaccinations across the world. In the worst case scenario, VXPASS is positioned to help the globe sort of identify and support the distribution of further vaccines that may be needed as mutations occur if we do not walk as a globe down a happy path. So hopefully we're moving on to childhood vaccines in the next 9, 10, 14 months. But if that ideal path doesn't exist, we are and will be available to help support the COVID distribution and rollout for all countries across the world.
Last quick question for you. How do you respond to the people who say, I don't like vaccines?
So I like the phrase that vaccines might be controversial, but owning your data shouldn't be. I don't like to get into the conversation of vaccinations and vaccination controversiality, but I think we can all agree that your data is your property. And if you can believe that, you can get on board with VXPASS.
Well, on that note, we'll end this session, and we really appreciate your contributions, both Meghann and Zach, to telling us about how we all as patients, individually across the world, can empower our own patient data. Please give a round of applause to Meghann and Zachary.
The biggest sickness in healthcare isn't a disease. It's not a bacteria or a virus. It's the silence. See, the data we need to combat diseases, to stop suffering, it's not waiting to be uncovered. It's stuck behind closed doors in stubborn silos. The healthcare industry has the data to improve our lives in untold ways, but no one communicates. And in that silence, countless lives are lost. That's why at EHR Data, we're building the largest ever shared data set of human health. And it won't belong to a hospital, government, a corporation. It will belong to the rightful owner of your healthcare data, you. We're merging healthcare records with blockchain to finally put you in control. Because your data doesn't belong on private servers. It should be in your hands in service to your health. The greatest sickness may be silence, but the silence stops when you have a voice. EHR Data. Own your health.